The UK Health Secretary says the NHS cannot be switched on and off during strikes as junior doctors in England sustain the longest walkout in the service's history. They claim industrial action is having serious consequences for patients.
I said to the receptionist that I'd rather die at home than die in hospital while I'm waiting to be treated.
Edwin was struggling to breathe and knew he needed help. But when the 72-year-old was rushed to Salford Royal Hospital early on Wednesday, he was told the wait was around 18 hours.
Between 70 and 80 patients waiting for treatment or being treated in cubicles, on trolleys, in chairs, and basically it was carnage.
Salford Royal says it's a challenging time and people with less urgent conditions are likely to experience longer waits.
There's a really busy time at the moment around the urgent emergency care areas for patients, but colleagues from across the NHS are working really hard to maintain the services and maintain the safety for our patients.
It's as new data shows how the NHS coped over the festive period. Between Christmas and New Year's Eve, 33% of ambulances took more than half an hour to respond to emergency calls. But that's better than the same time last year, when it was around 40%. One of the reasons for that is the drop this winter in the number of so-called bed blockers, patients who are well enough to leave hospital but with nowhere to go. That was down by around 1,300 patients. And the whole system has been helped by the fact that there are 4,600 fewer people in hospital with winter viruses this Christmas.
What do you want? When do you want it? Now!
Junior doctors are currently taking part in the longest strike in NHS history. The government says it's having serious consequences, but the BMA union argues they'd stop the walkouts with a decent pay offer.
If the government came to us today with that offer, we could cancel these strikes and never need to strike again. But unfortunately, that offer has not been forthcoming.
The health services problems aren't just expected to disappear next week when junior doctors get back to work. Flu cases are expected to keep on rising with children getting back to school. And then there is the Christmas period backlog, which has only been mounting.
After a consultant intervened, Edwin was called back to hospital and is now expected to make a full recovery. But what he saw in A&E, the strains in the system, are being repeated across the country. Rachel Venables, Sky News.